Welcome back. If you've noticed your child maybe can't keep up with the other kids during activities or exercising, as a parent, when should you worry? I'm here with Dr. Karla Smith from the Traverse Area Pediatrics and Adolescent Clinic. Welcome back, Dr. Smith.
Thanks for having me back.
So a lot of times kids are running around, they're playing, but maybe some parents out there, they notice their child's a little sluggish. When is it time to kind of worry and be concerned?
Well, as pediatricians and as parents, we want to obviously encourage physical activity as part of a healthy lifestyle. So we don't want things to get in the way of that. There are, however, some signs that parents should be on the lookout for. Most kids who are reasonably active should be able to keep up with the majority of their peers. Of course, there are different ability and skill levels, so there will be people who can be a little bit faster, a little bit slower. But if a parent sees that their child is always the last one in line when they're running, or if they seem to struggle running up and down the soccer field, just can't keep up with the other kids in the neighborhood, that's probably something that you want to draw some attention to and maybe talk to the child's physician about.
What about breathing? I know a lot of kids, when they're running around, they cough a little bit.
If your child coughs every time they run, if they seem to be breathing harder than other kids, if for older kids, if they complain that they can't get their breath, or that they're having chest pain or trouble breathing when they're running, though, you should definitely take those concerns to your child's doctor.
A lot of people, some of the symptoms you're discussing and telling us about, maybe they sound like asthma. I think they kind of sound like asthma. Is that a common problem then?
It's a fairly common problem. It's probably, of the exercise-related diagnoses, it's probably the most common, but it's not the only diagnosis.
Not the only, very important.
So you want to make sure that you're not assuming it's asthma, nor do you want to assume that your child's just out of shape.
Right.
So pay attention to those symptoms, talk to your child's doctor about them, and let them diagnose whether it's asthma or not.
So if it is asthma and they're struggling, I mean, you would think that's normal, but you're saying it's not.
Recognizing that asthma is there is important, but having asthma should not keep a child from participating fully in physical activity. We know of Olympic athletes who have asthma.
Really? Yeah.
So the key is, if your child has asthma, if they get the diagnosis of asthma, their asthma should be able to be controlled to a sufficient degree that they're able to participate in sports to the level that they desire.
So asthma, in a way, wouldn't be an excuse. So maybe something else is wrong then.
It should not be an excuse.
Now, what are some tips you can leave for parents tonight?
My tip, I guess what I'd like people to take home from this is, if you're seeing your child struggle, if they're breathing hard, if they're coughing with physical activity, get it checked out. Get it checked. If they have asthma, don't say, oh, it's their asthma, they can't participate. They can participate, but their asthma needs to be better controlled. Yeah, and that could be a sign maybe of something more serious. It could be. So it sounds like, when in doubt, call you. Call your doctor if you have questions. Absolutely. All right. Thank you so much, Dr. Smith. Thank you. If you'd like more information on the Traverse Area Pediatric or Adolescent Clinic, you can head over to our website, UpNorthLive.com.